Hello, everyone. We're just going to give a few more minutes to let people trickle in and then we'll get started. All right. Thank you for joining the Applied Basic Science webinar series. This series will be building on one another, providing a variety of topics that will come in handy to answer questions that may arise when adding CBD to your pet's regimen. Tonight, Dr. Stephanie McGrath will be presenting part 2 of Best Buds CBD trials in our furry friends. Dr. McGrath is an associate professor at Colorado State University College of Veterinary Medicine and Biomedical Sciences. Many of you know her as the principal investigator and lead researcher on multiple clinical trials using applied basic science CBD oil, first the safety trials and then trials for epilepsy and osteoarthritis. Welcome, Dr. McGrath.
Thank you so much, Jessica. Just give me 1 second. I'm going to get my presentation pulled up here and then we'll get started. Thanks for the introduction. Here we go. And please let me know if that is not looking correct. Otherwise, I will continue on. Excellent. Well, yeah, thanks for joining for part 2. Hopefully, most of you are able to catch the first part of the kind of update on the trials and research involving CBD and our companion animals over at Colorado State University that Applied Basic Science Corporation Organics has been a huge supporter and has played a very large role in. So thanks for inviting me back to talk a little bit more specifically about the clinical trials. In part 1 in January, we talked a little bit about some of the preliminary studies. So, I always kind of am in awe that this drug, supplement, whatever you want to call it, has been around for so many thousands, tens of thousands of years, and yet the science behind the use of this drug in a medical realm is really understudied. And so we had to really start at the beginning and show that it was safe to use in our companion animals, because that really wasn't known, although we suspected it would be. especially the hemp product that is made by ABSC Organics with really low to no THC is um, kind of presumed to be safe, but we didn't know that. And so, really, to try to understand what it's doing biologically and what it's doing um, from a safety standpoint was very important in setting the foundation for our clinical trials. And so, the webinar today, we're going to delve a little bit more into those clinical trials. We were able to show from our initial studies that it was really well tolerated, that it was measurable in the blood, meaning that although we were giving it orally, some medications don't actually make it in any significant way to the bloodstream. And so we were able to prove that when it was given orally, or actually in the studies that we did, not only orally, but also transdermally, so across the skin, that we were able to find it and measure it in the bloodstream. I apologize for the train in the background. I'm working in my home office, which is, fun these days with the distractions. But so we really found, I think, a lot of great information from the initial studies. We also came out of those studies with a lot of questions, right? We still didn't know what the appropriate doses would be for certain diseases. We didn't know whether they would be effective for all diseases or certain ones in certain animals. And so we really had still a lot of question marks that we needed to answer. And so we were able to use that foundational knowledge to move on to clinical trials. And so the next step for us was trying to answer some of those questions about whether this was a drug that would help in the majority of our patients, what doses would be appropriate, et cetera. And so I put up this image because to me, this is what all of my research is about. This is what my position in veterinary medicine is. And there's lots of ways of looking at and interpreting this picture. Back when we were able to do live live talks, it was really fun to put up pictures like this and get some feedback of what it meant to different people, because it's different. It's different to pet owners, to researchers, to scientists, to medical doctors, to veterinarians. And so personally, I think ultimately we're helping the dog at that end of the leash. We're helping to keep them safe, but on the flip side, they're also helping us. I think it really illustrates the strength of the human animal bond. But ultimately, whatever you see or get from this picture, I think we can hopefully all agree that it's an important image. Whether it's the medicine, the science, the lives that we touch, the lives that are touched by our pets, the bonds that are strengthened, the translational value of the research, ultimately, all of it is incredibly important and valuable. And it's really what drives me and what keeps me learning and searching and growing, and really what set my sights for these clinical trials. I really always try to have pictures like this. It's sort of what I call the bigger picture in my mind as I go through the research steps, because it's not just, oh, can we give this drug to a dog and will he be fine or will he not? The bigger picture is, can we help him? Can we make him age more gracefully? Can we help him his pain? Can we help with anxiety disorders that are affecting their lives and ours? And so, again, just sort of kind of keeping this bigger picture is really important to me as I move forward. And so I am fortunate enough to be able to use a lot of these initial studies that aren't quite as glamorous to start working on what I would consider the more exciting part of my job, and what I would consider the incredibly unique position that I'm in as a veterinarian. And so, launching into clinical trials, and I apologize, I know some of these pictures are hard to watch, but launching into these clinical trials, as I've mentioned previously, I'm a veterinary neurologist. And so using my knowledge as a doctor of neurology and treating seizure disorders was really important to me. So from a somewhat biased perspective, I was really interested in looking at the effect of CBD on epilepsy. And so this is a video that this dog's owner sent me. This was an early patient in my post-residency period. And, I've seen a lot of seizure disorders, and to be fair, in the grand scheme of things, this is pretty mild, right? I mean, it only lasted a few seconds. The dog looks okay. It doesn't look like it was, this super dramatic and serious disorder. But this dog was having 30 of these a day, so more than one an hour around the clock, which is, as you can imagine, incredibly intense. And it did start to affect this dog's quality of life, not only because of the seizures, but because of um, the effects that the seizures can have on the brain, and also because of the medications. So the medication side effects also had a very severe, probably a very severe effect, in my opinion, on this dog's ability to function as a pet. And so as the years go by, I start anticonvulsants. Just out of my residency, I'm feeling good. I start some of our first line drugs, potassium bromide, phenobarbital. Rarely have I had that not work. And then I start reaching for some more because these aren't working. And so I reached for zonisamide, I reached for Keppra, and I'm starting to sort of max out on all of these medications and all of these dosages, to where it was starting obviously to get extremely frustrating and pretty tragic. This dog was so severely affected by the end, probably partly from the constant seizure activity and partly from the medication side effects, that she did elect humane euthanasia due to lack of what she perceived as a good quality of life. She did allow an autopsy, and we were able to perform that at CSU. And I always, especially earlier in my career, not necessarily hoped, but always sort of expected that I would find something else. Like maybe this dog had some weird brain tumor that we weren't able to diagnose, or, some weird metabolic disorder, or, something that would explain why I failed so miserably at treating this dog. It can't just be epilepsy. Um, and the final diagnosis on the autopsy was that the brain is unremarkable and consistent with most cases of idiopathic epilepsy. So your generic good old epilepsy was affecting this dog, and to the point of me failing to treat the dog, and the dog ended up in a humane euthanasia situation. So pretty devastating. And this isn't the only one. I mean, a very sad and unfortunately a not uncommon example of what I deal with these refractory cases. So needless to say, we'll hop off to a brighter note where we are able to launch this study. I'm super excited because I am so frustrated with these cases, and starting to look at different drugs that maybe don't have the side effects that some of our more standard anticonvulsants have, drugs that maybe work better, at least for some dogs. Maybe there's a place for some novel treatments. I certainly hope so. And so exciting to be able to start looking at CBD. And this was actually prior to the FDA approving the human form, or the human medication treating epilepsy, the CBD, FDA approved CBD medication that is now approved to treat humans with epilepsy. This is prior to that. And so we're kind of really going out on a limb and hoping for the best, of course. So Applied Basic Science Corporation was generous enough and interested enough in supporting a very sizable pilot study. So really the very first study of its kind, looking at the effect of epilepsy, or the effect of CBD on seizure frequency in poorly controlled epileptic dogs. So these are dogs that are client-owned animals. So these are dogs, we did not induce epilepsy. These are dogs that have naturally occurring disease. That's a very important part of my research. We performed what we call a prospective study. So we enrolled patients and followed them out in a prospective manner rather than having looked at patients that had previously received CBD. So this was a very controlled study. It was double-blinded, meaning that we did use a placebo in addition to CBD. So some dogs got CBD, some got a placebo, and double-blinded in the sense that I didn't know which dogs got what, and neither did the owners. So we were both blind to which medication. It takes away bias, which I know can sound silly in the veterinary world. How can dogs be biased? But all the results are being recorded by their owners, who obviously can be biased. So placebo-controlled studies are incredibly important. to the quality of the research. And so we launched this study. We were able to enroll 16 dogs. And so we enrolled more than that, but 16 dogs completed the study in full. They all had to be considered idiopathic epileptics, just meaning that they went through a normal epilepsy workout to rule out other causes of seizures, to make sure that they didn't have brain tumors or infection or trauma or something else that was causing the dog to have seizures. This had to be the genetic form of epilepsy. They had to be what we call refractory. So they had to have at least 2 seizures per month prior to starting the study, while receiving our standard anti-seizure medications. So they had to be on anti-seizure medications and still having seizures despite what we would have considered adequate treatment. Once they enrolled in the study, they were given either CBD or placebo. We had 9 dogs that completed the study in the treatment group and 7 dogs that completed the study in the placebo group. Some dogs were taken out of the study for multiple reasons. Some had uncontrolled seizures and they were deemed, that there was other intervention that was necessary. Some dogs were lost, so owners were lost to follow-up. They would start the study and never show up again. Some dogs were euthanized, unfortunately, during the study for seizure activity. And so there were a variety of dogs that didn't complete. But of the 9 and 7, we had a total of 16 that completed the entire study. In the treatment group, the dogs received 2.5 milligrams per kilogram of CBD oil twice daily. The study period was 3 months. So they were all enrolled in the study for 3-month period. They were required to stay on their standard anticonvulsants. So there were no changes that were allowed if they stayed in the study to their anticonvulsant therapy going in. So we were not allowed to change any of those medications unless we disenrolled them. And then we did check, we did physical exams, we checked blood work, and we checked CBD levels every month to monitor for, again, just for safety, any adverse effects, et cetera. And then we also performed anti-seizure drug levels at the beginning and the conclusion of the study. So the results of this study were really exciting. We also, I will be totally honest, take it up with a little bit of grain of salt. It is a small study. So although exciting, first of its kind, great launching point, we have to take our results with, with understanding that there's a lot more dogs that need to undergo studies like this for us to really prove that this is a significant addition to our anticonvulsant therapy regimen. And so what we found from this study is that there was a significant reduction in seizure frequency for the treatment group as compared to the control group. However, when we look at whether those dogs underwent what we refer to as a 50% reduction, so they to be called a responder to an anticonvulsant, we'd like to achieve a 50% reduction in seizure activity. There was not a significant difference there. And so to look at numbers for the CBD group is on top of that dashed line, and then the control group or the placebo group is on the bottom. So on average, the dogs in the CBD group were having 4 seizures. This is averaged across all of them per month. And during the study, that dropped to 2.7. The placebo group was having on average 2, and they didn't change. And so there was obviously a significant difference there. These are all were run through a statistician as well, but clear difference. And then what we did notice in the CBD group is that 89% of the dogs had a reduction in seizure activities. So not necessarily a 50% reduction, but almost 90% of the dogs underwent a reduction in seizure frequency versus the placebo group where only 43% had a reduction in seizure activity. And then the other 57% either stayed the same or had an increase. So again, when we define a responder as that 50% reduction in seizures, we did not have a significant difference. 2 dogs in the CBD group and 2 dogs in the placebo group underwent a 50% reduction in seizure activity. So no difference there, but certainly an exciting trend. So as far as adverse effects, like I said, we also were monitoring really closely for any safety concerns during this study since it was the first client-owned CBD study, dog study. And so we looked at blood work routinely every month. And the only difference that we saw was an elevation in the alkaline phosphatase, which is a liver enzyme. I did address this briefly in the last part of this webinar as well. But basically, there was a significant difference in that liver enzyme between the CBD group and the placebo group. To be fair, CBD is, we know, metabolized by the liver. And so there is still question about whether it is just making the liver a little bit more leaky. So it just leaks this enzyme into the bloodstream versus actually causes liver damage or dysfunction. We have not seen, still to today, have not seen any signs of liver dysfunction at all. So my suspicion is that it's a non-issue, but definitely something that we were keeping an eye on and absolutely still are. The other thing I mentioned was that we are measuring anticonvulsant levels. So there is a lot of question floating around about whether CBD alters the concentrations of other anticonvulsants. It's important because we often talk about it as adjunctive therapy, meaning that we want to use CBD in addition to other medications. So to not have a great understanding of what that drug-drug interaction might be is unfortunate, right? We need to start gathering that information. And so in this study, we were able to measure all of our anti-epileptic drug concentrations. However, the one we really focused on, spoiler alert, is that none of them actually changed significantly in the 3-month period of the dogs that were given CBD. But the one we were most interested in was phenobarbital, because that is also an anticonvulsant that is metabolized by the liver. And again, in this study, we did not show a significant difference. There was some increase, some decrease, but all of it was minor enough and did not vary significantly from the control group. And so ultimately, at least in this short period of time, we did not see any negative drug-drug interactions with the anticonvulsants that the dogs were on. We also monitored for any behavioral adverse effects. So anything that we might not pick up on our veterinary exam. So something that, maybe the owner is noticing at home that is not obvious on exam. So we had owners fill out a behavioral questionnaire throughout the study period, and we compared the study results before they started, during and after the study, so that we could better assess whether there were any changes in behavior. The categories that were assessed by this very lengthy questionnaire are aggression, rivalry, fear, anxiety, trainability, excitability, and energy levels. So did they become more lethargic? Were they all of a sudden aggressive? And from this questionnaire, we did not see any significant change in any categories. So we did not at least perceive any behavioral adverse effects or changes. The last main thing that we did here was we took the dogs that were on CBD, of which again there were 9 in the treatment group, and we looked at their change in seizure activity as compared with what their blood level was for CBD. So what we found from this graph is that there was a significant correlation between CBD level and seizure frequency, meaning that the higher CBD level that was achieved in a particular dog, the dog tended to have a greater reduction in seizure activity. So all of these red dot dogs were all given the same dose of CBD, but because of variations in metabolism, some dogs were able to convert that CBD that they were given more highly into their system. So their blood levels went up more than some other dogs that didn't metabolize it in quite the same way. And those dogs that achieved higher levels underwent a greater reduction in seizures. So they did better in this study. And so again, 9 dogs is a small number, but it was a really exciting, in my opinion, probably the most exciting result that we got out of this study. Meaning that we start with a dose for a dog, but we don't always base everything on that dose. Every dog or human or animal metabolizes things differently. So sometimes we need to dose escalate or start increasing that dose. And so my take-home message from this study was that maybe if we can get enough dogs over that sort of threshold, if you will, so if we can achieve higher blood levels, we might be able to gain better seizure control. So we might reach into that responder group if we're able to sort of move to that right hand side of the chart. And so that also was, I think, a really important launching point for further studies. So conclusions from this study, we found a significant reduction in seizure activity in the dogs that received CBD. We did not see any major adverse effects. We do need to continue to monitor this liver situation and make sure that it's safe. And so ultimately, as probably most research studies end, more questions are asked and more research is needed. So we were able to move forward with another study, which was sponsored or a grant was awarded from the American Kennel Club Canine Health Foundation. So we were able to continue working with ABSC Organics and using their product and perform a larger study with the support of the AKC Canine Health Foundation. So we took all the information from that first study and launched a larger study of which we enrolled 60 dogs. Very similar criteria to enter the study: intractable epilepsy treated with conventional anticonvulsants, and CBD was used as an adjunctive or add-on therapy. This was a crossover study, which is a slightly different study design. So each dog was given a placebo in one phase of the study and then CBD in the other. But the which arm was which, it was randomized. So, and again, double blinded. So dog starts the study for 3 months. He receives a certain product, whether it's placebo or CBD, goes through a washout period. And then the second part of the study is he's receiving the opposite. And again, the owner doesn't know which phase is which, and neither do I or my staff. And so still considered a double-blinded study, but a longer, slightly more powerful study design. So we were, I always also kind of joke because a lot of pet owners come in and they really don't want their animals going under general anesthesia for this whole epilepsy workup. This is our magnet and what our animals look like. This is what they picture their animals looking like, kind of just walking on and laying down nicely. But this is in actuality what we need to do. So it is a pretty big procedure for our guys. It's kind of cool. This whole that whole picture came from this really great article. I won't digress too much, but looking at the awareness and response to different stimuli in different parts of dogs' brains. So this guy Gregory Burns is really kind of mapping out their brains. Some of you may have seen these articles. They're really cool. But people are really hoping that we can get them in the magnet looking like this and the MRI looking like this. Unfortunately, he takes almost a year to train these dogs to do what they're supposed to do. So unfortunately, we don't do this, but I always think it's pretty exciting. And here's a little clip. I don't mean to digress, but I always think this is really cool. So there is this little blurb on him. There's lots of different segments, but they train these guys. He has like this whole setup in his basement, and I think he has different staff that work with them, and they get them to the point that they actually are able to go put their little heads in a stand and sit in this MRI for X amount of time getting scanned. So I wish that I could say I did this, but I don't. But it's pretty cute. So, but it's a fairly painless event, and it does help us rule out a lot of important diseases. So back to the trial, for this trial also made another pretty big change. We increased the dose to 4.5 milligrams per kilogram twice a day. And that was based partly on that chart that I showed you with all the red dots in the pilot study, hoping to get more of those dogs into that higher plasma level range. And it was also based a bit on Epidiolex, which was the FDA approved drug for human epilepsy. And they start at 5 milligrams per kilogram and go up from there. And so we felt like it might be worth increasing that dose a little bit to see if we can move some more dogs over to that end of the graph where we gain better seizure control. And so I'll again give you sort of a spoiler alert, is that I don't have results of this study yet. It was a 3-year study, which is actually scheduled to end in March. It was delayed by a couple months because of COVID. We had to put things on hold for a little bit, but We are we've enrolled our last dogs, so there I think 3 more dogs still in the study that are finishing up in March. So we should hopefully have results of this study by the end of the year. To be a good scientist, I'm not allowed to unblind myself before the very last dog is done with the studies. So I don't know any information yet. The few things that I do know is that we did not have any severe adverse effects. All of these dogs handled the medication very well. They did not have vomiting, diarrhea, any of the things that we saw in the initial studies. They did really, really well at home. And we did see some changes in their blood work. And again, that is yet to be correlated with the CBD at this point, but it does look like there wasn't any sign of liver dysfunction, just that same ALP elevation. So jury is still out, to be fair, on what this does to the liver, but so far, I would say pretty positive results. But as far as seizure activity, again, this data will be analyzed this year, and we hope to be able to present some more exciting results later on in the year. So epilepsy, still a long way to go. Even if this study is exciting, I think still we need to figure out different dosages. So maybe these dogs did really well on 4.5, but do all dogs need 4.5? We had some dogs that did great on 2.5 milligrams per kilogram. Maybe some could get away with less. Maybe some need more. And so I think still a lot of dosing questions, still a lot of safety questions. Like I mentioned, I think we still have a lot to learn about what this drug does or doesn't do to the liver. And so I think, in a more long-term sense. So I think still lots of questions in the epilepsy category, but definitely off to a great start. More research questions, right? So from epilepsy, it just keeps growing. We're failing at treating pain. We're failing at it from medication side effects to inadequacy to the opioid epidemic. We're just not where we need to be in terms of chronic pain. And so another major challenge for us. And so we're looking at recently, well, a couple years ago now, we performed an osteoarthritis study that was trying to assess the effect of CBD on these chronic pain situations. So we looked specifically at dogs with osteoarthritis. Again, client-owned dogs, naturally occurring diseases. This study, we're able to have 23 dogs complete this study, a very similar study design as the current epilepsy study. So prospective, double-blinded, placebo-controlled crossover study. So again, each dog received CBD or placebo, depending on the randomization of the phases. Obviously had to have osteoarthritis, also had to have an identifiable lameness. So it had to be noticeably lame in any of the limbs, and the disease had to be stable. So we weren't looking at an acute change like a cruciate ligament rupture or something like that, where all of a sudden the dog's lame on a leg. This is chronic arthritis that we were trying to assess. These dogs had to be receiving conventional pain management for at least 4 weeks prior to starting. They stayed on that same pain management throughout the study period. CBD or placebo was added on. Each arm of the study was 6 weeks. So 6 weeks of either CBD or placebo, and then the opposite. Again, we performed routine blood work and CBD levels every month. We used to look at outcome for these dogs. We used a few things. We used objective gait analysis, and that's what's shown in this picture. So they walked across this pressure system to try to objectively assess whether the dog was bearing more weight in the affected limb, less weight. So basically an objective way of saying, is the dog more or less lame or the same, rather than just watching the dog with our eyes. It gave us an objective analysis. We also used accelerometers or Fitbits for dogs. So we outfitted each dog with a collar that allowed us to monitor their activity. So did the dogs feel better? Did they move around more? Were they more interested in going through their doggy door and playing outside while their owner was at work, et cetera? And so again, sort of a more objective way of looking at the dog's activity level. And then we also used owner outcome assessments, which are a very classic way of looking at change in quality of life when it's associated with pain. So did the owner perceive that the dog got better? Again, remember, they're blinded to what their dog's receiving. So it's a reasonable assessment tool for a study like this. So we had mixed outcomes. We had from the objective gait analysis, we had one of the parameters, so percent body weight distribution, showed improvement. So meaning that the dogs uh, bared more weight on the affected limbs when they were on CBD versus when they were on placebo. So we did see a significant difference there. The dogs, I can't say they were less lame, but they were more willing to bear weight on those affected limbs. So that was certainly a positive outcome. Owner assessments also showed improvement at certain time points. So it wasn't always like week 1, the dog did better. It wasn't always week 6. It was at various time points, there were significant improvements that were only seen within the CBD group versus the placebo group. There was also the accelerometry data that we analyzed, which was that Fitbit, and there were no significant differences noted there. So we did not see any change in activity levels in dogs that received CBD versus placebo. To be fair, accelerometry to some degree is falling a little bit out of favor in these studies because they do feel like there can be some bias introduced with that. So if the owner thinks that the dog is on CBD, they may be more apt to take the dog out for a longer walk than they would if they didn't think their dog was on CBD. It might be a holiday season where the UPS man is coming every day and the dog's jumping up a lot more because of that, not because it feels better. And so there's some question about the reliability of that data, but I think it's a fair thing to look at, and we did not notice a difference. Adverse effects. So again, we saw this darn ALP go up in 60% of the dogs when they were on CBD. Again, no change in liver dysfunction. So we did measure the actual function of the liver, which didn't seem to change in the 6-week period. They did not show any other clinical signs that were concerning of liver dysfunction or failure. So there wasn't, lethargy or inappetence or anything else that was of concern. But again, I think bigger studies are needed to truly say that it is not harmful. 2 dogs did experience vomiting as the only clinical adverse effect. 1 dog was pulled from the study because of it. An owner gave the CBD and the dog vomited and decided he didn't want to be part of the study. The other dog did vomit the first day of receiving CBD and then remained in the owner elected to stay in the study and remained in the study and did not have any more concerns or issues at all. So just that 1 episode of vomiting on day 1. Okay, so we've learned a lot. With the help of grant agencies and ABSC Organics, we've been able to really launch a lot of veterinary research that is critical, and it's been really exciting. There's a lot more. Well, the osteoarthritis study was just recently published. Like I mentioned, the epilepsy study, that data will be analyzed this year. We're constantly looking at starting new studies and doing more research. I'm pretty devoted at this point to CBD research. And so to me, although we gain a lot from these studies, there's always more to analyze and look at. And so I think a lot more just within those pain and epilepsy categories. And then, of course, other diseases. Does this treat, people talk about it treating nausea and cancer and anxiety and all sorts of other diseases. So I think there is, I always probably, I don't know if it's a kind of cheesy way of doing it, but I always say it's kind of the tip of the iceberg, right? We have this drug that's been around forever. We have just started to kind of scratch that very superficial surface of this giant iceberg. And so tons more to learn, tons more to be done, but I'm very thankful for all of the research that we've gotten to do so far. So, of course, a huge thank you, as always, to Applied Basic Science Corporation. Big thanks to folks at CSU and the Pharmacology Shared Resource Lab that have really helped with a lot of the sample prep and running and analysis. That's been key. And, of course, the AKC Canine Health Foundation for being a proud supporter of CSU research. I'm very thankful to have their support. They've been really excited about this research as well, and it's been a great partnership. So and then of course to my team, I did include the email for our team in case people do have any questions more specifically about any of these trials, future trials. Again, we're always looking to do more. So I've included them in here as well. And I will end on that note. Thanks.
Thank you, Dr. McGrath. We just have a few questions and then we'll close out for today. So I'll start with that. About how long does it take for CBD to begin relieving symptoms in a pet? I know you've touched on this, but that is a
Yeah,
common question.
yeah, it's a great question. And not a super easy answer because I guess a simple answer is that when we think about drugs, we think about how quickly they can get into the body, how quickly they can reach what we call a steady state level. So, when can they sort of reach that maximum goal or level that we're looking for? It's fast with CBD. So, there's been, in addition to my pharmacokinetic studies, there's been a few others that have shown it's probably anywhere from a couple hours to, you know, less than 12 hours. So somewhere in that, usually that we're looking at that kind of 4 to 6 hour mark for dogs. And that means that probably in a couple days, they've reached their, again, what we call a steady state level. So we've kind of reached that maximal level. That doesn't always, so that's exciting. That's fast for a drug. Lots of drugs can take weeks to kind of reach that goal. So it's fairly rapid. That being said, that level doesn't always equate to maximal effect. So just because we have gotten to a really nice level in the bloodstream, it may not have had enough time to actually treat whatever disease that we're hoping to treat. And so that's why I say it's kind of a complicated answer, because we feel like, for example, with epilepsy, we think probably within about a week we should start seeing some efficacy. And similar to pain, it can take a week or two, but we think that we should start seeing some improvement within that time. Anxiety notoriously can take a lot longer. So, that's a very, I think, sort of profound behavioral issue that can take a lot longer to treat. So, when you look at things like treating those disorders with something like Prozac, they say to give it months to take effect. And so, again, I don't think anyone knows at this point with CBD, but again, I don't think that maximal blood levels always equals efficacy. So I know that's not the answer probably you were looking for, but I think it can take anywhere from, a week or less to, in some cases, probably a couple weeks to really have maximal effect.
So to kind of follow up on that, if somebody is treating their pet and not seeing the results after a week or two, what advice or recommendations would you make, broadly speaking? Because obviously, case by case, but
Yeah, no, it's a good question. I give it longer. I think that we just don't know enough yet to say if you've seen nothing in a week, then it's not going to work. I think that's probably a bit rash. I don't think we know enough to say that it won't work. I think sometimes improvements are subtle. So, even with something like pain, maybe that dog is feeling better, but it's hard for us to assess. I mean, people ask us all the time, how do I know if my dog's in pain? I don't know. I can't ask him. And even as veterinarians, we're like, we can look for lameness. We can use pressure plates and things like that to look for objective ways of seeing that. But ultimately, really, if you think about it, even with yourselves, you may still limp. You may still have some discomfort with something like, say, sciatica, or arthritis, but so we might still limp, but maybe ultimately we're like, gosh, I have more good hours in a day. I feel better for more hours of the day than I used to. It used to hurt all day long, and now it doesn't hurt as much. And I have sometimes where it doesn't really hurt at all, and sometimes where I've had a long day and I went on too long of a walk and now I'm uncomfortable at dinner time. So I don't think it's fair to say if you don't see marked or obvious improvement of whatever you're trying to treat in a week, that it's not going to work. I think we honestly, with this new of a drug, new in the science world, we probably have to give it. I would encourage, at least I encourage epilepsy owners to give it at least a month, if not longer. As long as they're not seeing any negative side effects, then I would encourage at least a month.
okay. Have you ever noticed any significant health benefits of CBD in canines? So outside of epilepsy treatment?
Oh, outside of epilepsy, that's a tough question. I would have trouble answering that because I don't use it outside of um, outside of research. So I don't have as much exposure to it as some of the general practitioners or, even CBD advocates in the veterinary world that are really treating hundreds of dogs a year from lots of different disorders with CBD. I don't have that same experience. I'm really coming at this from a very what I like to consider a very scientific, researchy, um, stand. And so I don't really have the experience to say, oh, I've treated 100 dogs this year for these different diseases and I've seen it work here and not here. I really do focus on the research side of things. So I guess I think that's kind of a hard question for me to answer. I think anecdotally, I hear from tons of clients and owners, and people are enthralled. People love this medication. They have tons of questions. They're really excited to tell their stories. So from like my non-sciencey self, but my, just like friends of pet owner self, I would say it seems like people are having, at least a lot of people are having great luck. Some people aren't. Some people will say, you know what, I tried it, it didn't really work. Do you suggest something else? Do you suggest a different dose? It didn't hurt my dog, but I'm not sure that I saw the effect I was hoping for. And so it's certainly not all positive stories, but I would say there's a lot of just emails and things that come into myself and my team that are really exciting. But again, I think personally, I think we need the science to back it to really say yes, it works for this disease versus it doesn't. So
Okay. Is there any chance that CBD could replace current treatments for idiopathic epilepsy?
that's the goal. Yeah, I think right. We have to take it all stepwise. So right now, we had to start at the beginning and say that it wasn't going to hurt dogs. And then we had to say, yes, it made it to the bloodstream of dogs. And then we had to say, you can add it on to standard therapy because ethically it's hard if we haven't proven that it can work as an anticonvulsant in a dog with epilepsy, then it's not considered really ethical research to say, yeah, let's enroll your dog who's having seizures, just give it CBD or just give it a standard anticonvulsant medication without having proven that it can even work. Otherwise, I mean, as you can imagine, that's not really an ethical study. And so we have to take it stepwise. And I think we're almost there, to be honest. I think that we've shown in that original pilot study that it has anticonvulsant effects. It has. I mean, that's not really up for debate anymore. I think the bigger debate is why does it work in certain dogs and not others? What doses are appropriate? What levels are effective? What kind of range are we looking at? Is twice a day dosing appropriate versus more or less often? And so I think there's still some like kind of fine tuning that we need to do. But I think the next step beyond that fine tuning is to put it up against an anticonvulsant that we use as standard of care and say, does this work versus something like phenobarbital? Is there a difference? Does it work better? And so I think we're close to using it as a standalone drug, but I think we still need a little bit more information.
Sure. Will there be feline efficacy trials?
Yes, hopefully, I hope. Yeah, I think that's also a really important and very high interest portion of research in the CBD world as well. So, yeah, we have to start a bit at that foundational level. There have been a couple of studies that have looked at safety and pharmacokinetic analysis in cats. So I think we're starting to build that foundation that we built in dogs. And so I think the next step would be moving towards clinical trials. And I think it's absolutely of interest. It's definitely of interest of mine. Of course, it all requires funding and being awarded money to run these clinical trials. So I personally am working on it. I've written a few grants looking at feline medicine, but I think it's uh, it's lagging behind a little bit behind the dog studies, but I think it's of high interest, and I would be very surprised if that were not in our near future.
Awesome. And then finally, will there be opportunities to participate in future clinical trials?
Yes, yes, and yes, of course. Yes, we thank you for asking, whoever asked that. We are, yeah, I mean, we're always, like I mentioned, we're always creating new clinical trials. We have, I mean, we have a great team in place, and we are constantly searching for funding, starting new trials in many different arenas. So I think I don't expect this to end anytime soon. I think hopefully it will just keep snowballing and keep going, and we'll just continue to do the research and gather more information. And so, like I mentioned earlier in my presentation, it's very important to me to do research in animals that have naturally occurring diseases. So client-owned animals that have naturally occurring diseases rather than inducing it. I don't do that research. So I am always looking for owners that are willing to participate in our studies. And again, the email address there is a great start. We also have a clinical trials page on the CSU neurology website. So if you just Google CSU neurology clinical trials or something like that, there should be a very easy to find tab that shows all of our current clinical trials, not just CBD. But yeah, certainly we're always looking. That's one of the biggest challenges, to be honest, with these studies is enrollment. So finding owners that are willing to participate, and it's a commitment, to be fair. It's not something to take lightly. We have tried really hard to make it as convenient as possible. So we will enroll nationally. We will work with local veterinarians. We'll do a lot to try to make it again as convenient as possible for owners. They're not, they don't have to live 10 minutes from CSU and come in every day. It's definitely something we've tried to move towards a more convenient and broad outlook to increase our enrollment and our owner compliance. So yes, long story short, we are always looking for participants.
Great. So that's it for tonight. Thank you for joining us, and thank you, Dr. McGrath, for the insightful presentation. If you're wondering how you can help with future CBD pet research, here's one way. The ABSC Pet Health Foundation was created to accomplish key goals in improving pet health care in the United States, including funding companion pet health research and clinical trials. Through donations, the foundation is able to award grants to scientists and professionals in research that addresses illnesses and diagnosis of diseases and the development of effective treatments and identification of disease prevention strategies. So to learn more or make a tax-deductible donation, please go to absccares.org. All right, well, thanks everyone and have a good night.
Thanks, Jessica.